Welcome to Discover You, an inspiring podcast exploring cutting-edge solutions to our everyday psychological challenges. We explore complex mental health issues and talk to professionals, experts, and renowned authorities at the forefront of transformative healing. Our mission is to educate and destigmatize, and to ultimately view mental health as a proactive quest for optimized living and equilibrium, rather than mere crisis intervention. My name is J.D. Kalmenson, CEO of Montare Behavioral Health, one of the larger and faster growing private behavioral healthcare companies in Southern California. Welcome to another exciting episode of our Discover You podcast. Today we will be discussing something incredibly timely and relevant, especially with the onset of COVID-19 and all the chaos that it created in our society and really every part of how we live our lives. The advent of telehealth is something that is more necessary than ever. Given the social distancing, the ability to find therapeutic and psychiatric care through a technological platform is something that is becoming increasingly more and more prevalent. And therefore, it is so exciting to discuss with you today the pros, the cons, the advantages, and the disadvantages of telemedicine with our illustrious guest, Dr. Jon Shaywitz. Dr. Shaywitz is a Board Certified Psychiatrist, and he's the staff psychiatrist at Montare Behavioral Health. He received his BA with honors from Brown University and his medical degree from Harvard Medical School. Dr. Shaywitz completed his residency at UCLA, and where he was selected chief resident for the Anxiety Disorders Program. Dr. Shaywitz was the director of the Anxiety Disorders Program at Cedar Sinai, the medical director at Glendale Memorial Hospital, as well as the medical director of behavioral health at Mission Hospital at Laguna Beach, and Mission Hospital, Mission Viejo, and the medical director of La Casa Psychiatric Facility. He's also the co-author of the second edition of the best-selling book, Overcoming Dyslexia. Welcome, Dr. Shaywitz, and I'd like to begin today's interview by asking you, at the onset, what advantages do you find as a clinician or as a doctor and a psychiatrist telehealth might provide in treating patients who are suffering with behavioral health conditions?
Well, first, JD, thank you so much for having me. And as you said in your introduction, this is such a timely topic. You know, in medicine, there's always a sense of wanting to bring care as a provider to the patient or the client. And telemedicine, even pre-COVID, really allowed us as clinicians to do that. With COVID, it makes it even more important and more helpful. The greatest advantage one has with telemedicine is accessibility and flexibility. We're able to, again, be convenient for the patient's or client's schedule and really bring our expertise and our clinical knowledge to the clients or patients, so really they don't have to be on a wait list, and they can really receive their care in a social, and especially with COVID, in a socially distanced manner, but also in a timely manner as well, which I think is really important.
That's true. The timeliness is incredible, and it takes away a lot of the ancillary inconvenience of travel and scheduling and whatnot. I guess I would love to know if the advantages are more felt in psychiatric intervention or maybe therapeutic intervention. I know that psychiatrically it's a blessing because the evaluations don't tend to take as long as, let's say, a full-on therapeutic session. But in your estimation, do you see the advantages being more felt in one arena over another?
Yeah, and I think in behavioral health, it really lends itself to telemedicine being really useful and effective. There is no physical exam in behavioral health. Where our currency, if you will, is really our data comes from what the patients or clients are telling us, and that there's no barrier to that with telemedicine. So, of all the areas or specialties, unlike a physical exam, we're going to need to listen to the heart or do vitals. This is a specialty, an area where there really is not a barrier, and it really lends itself quite nicely to to telemedicine. I think even within telemedicine, to conceptualize the different settings and how telemedicine can be used within behavioral health for an outpatient setting, an inpatient setting, and an emergency room setting. And again, with all those settings, it's very, I see it even before COVID being quite helpful, but even now with COVID even being more and more, even being more effective. As an example, there's, with the folks that are coming in with behavioral health issues, a particular setting where it's quite important to have it in a timely way is individuals coming in to an emergency room with, let's say, psychotic and is being assessed by one of the providers in the emergency room where there is no behavioral health provider, which occurs quite it's pretty there's a lot of times where that occurs, and there is no psychiatrist. And so before telemedicine, a psychiatrist would have to be called, and often takes anywhere from 2 to 3 hours for even a provider to come to see that individual in person. With telemedicine, specifically with that setting, the psychiatrist can actually assess that client, determine, or patient, determine if they need, depending on their acuity, they need to go into an inpatient, or they can be seen or released and have follow-up in an outpatient care. And even with outpatient care, pre-COVID, more and more providers in behavioral health were choosing to do telemedicine as their for outpatient appointments. And interestingly, while this was the providers enjoyed it, this was something that the patients or clients really preferred as well. They even things like they didn't have to worry about parking. Schedules were more flexible. They didn't have to, the concern about, missing work, for instance, wasn't an issue. So those are all, not only was it, convenient and flexible for the provider, but also quite flexible for the client or the patient as well.
That's so interesting. And, something else that comes to mind that telehealth would really alleviate as a concern would be, sometimes clients or patients are traveling and they're on vacation or they're away for work for extended periods of time. They run out of a prescription, they run out of a medication, and all of a sudden they have to start scrambling in this foreign city where they don't know any healthcare providers. They have to, number one, find somebody who they can trust. And number two, they have to basically go through an entire new evaluation to get an extension of an ongoing prescription that with telemedicine would be a simple 15-minute or 20-minute telehealth appointment, and they can get their prescription upped again. Is that right?
That's absolutely right. And I think before telemedicine, often individuals who needed behavioral health care would turn to ERs or urgent cares, or even to go to their PCPs and have to wait for some time to get in or to get that prescription. As you had pointed out, if they're away and traveling, the PCPs wouldn't be in that same state or that same area. So the urgent care or the ER would be where the individuals would seek care to get that prescription. The challenge, the concern on that was there's no continuity, and where I think again the telemedicine, in addition to accessibility and flexibility, the third area where it really affords is continuity. And just as you alluded to, individuals who would like a prescription or or need a prescription are not having to go to a brand new provider. They're able to use telemedicine for a provider that is familiar with their history and can, in a fairly efficient way, treat them in a fairly quick manner, but also a very thorough manner as well.
Absolutely. And just to highlight and point out that flexibility and accessibility for psychiatric intervention specifically is so incredibly important and significant, because if you think about it, we put ourselves in a lot of these folks' shoes. Taking medication on an ongoing basis to maximize functionality and optimize our human experience is challenging. It's difficult. It's difficult on a host of different levels. And it's so much easier to just let things slide. So when we are able to introduce new levels of accessibility and convenience, it really helps ensure that people will be, continuing a medication regimen with consistency, and so that they can actually be optimizing, their full functionality. So it is something that's so incredible. But for now, let's take a moment, and I'd love to hear your thoughts on some of the disadvantages or potential deficiencies, reservations, or concerns that you might find with the intervention, with the doctor, the psychologist connecting and prescribing on a telehealth platform, and not having the in-person patient-client experience where you can physically look at them in the eyes, and you get a certain, perhaps different level of understanding of the individual when you're actually in their physical presence, as opposed to simply seeing them from a screen.
Yeah, absolutely. And I think, again, having detailed the advantages, which I think there are many, some of the more challenges in doing telemedicine concern, when individuals, or when you're talking about such sensitive issues as grief or depression or anxiety, it lends itself to really one-on-one interaction. And there's really sometimes no substitute for being within person to person within a room versus being on a screen. And in behavioral health, and part of what one of our large components of our standard exam is a mental status exam, and as part of a big component of that is affect. And affect is how one observes an individual from a third party, or from how I would observe a client or a patient. And that can, things that we learn are the intangibles. And those are things that are best when you're looking at someone, as you described, when you're able to really take it all in within this person to person. And sometimes that does get a little bit lost when it's via, on a screen and folks are away. Things like assessing side effects. Sometimes there's some movements. Sometimes medications one is given for behavioral health can cause some movement disorders, and that's can be best observed or evaluated in person. But again, I think the big challenge would be just that person to person for some of these areas like depression or anxiety, and to be able to really get a sense of some individual's affect, which can be missing a little bit when it's on a screen. Other things like technology. Sometimes I think just getting the technology ready can be a challenge with the Zoom or Skype or whatever platform is being used. Sometimes an individual, in terms of confidentiality. So we have the affect and observation. We have technology as a disadvantage, and that we also have the the confidentiality. This is all the platforms are geared towards being HIPAA approved, but just as it can be flexible for an individual to talk in doing lunch at work, and that can be an advantage. A disadvantage can be, it's up to that individual to be able to make sure that they're in a quiet room, that it will be, as there's a lot of confidential information being exchanged. So I think sometimes the advantage can also be a little bit of a disadvantage and a concern, that we want to make sure that there's, that they're in a space that is that will be confidential and that they feel comfortable about speaking. So I think those three kind of components can be some disadvantages, and I do believe the advantages outweigh the disadvantages, but I think the more technical aspects of the trying to get individuals used to the technology who may not be accustomed to it, as well as the confidentiality. But the big thing is trying to really get a sense of someone's affect, or really get a sense of, especially in an initial evaluation, getting a good feeling of what, things that like I said, the intangibles that sometimes may get missed through telemedicine or through video.
Thank you so much for that very insightful answer, Dr. Shaywitz, about the disadvantages and some of the reservations that telemedicine might might introduce. I would love to pick your brain to ascertain whether, in your view, there is a distinction between psychiatric intervention through telehealth and therapeutic intervention through telehealth. Whereas with psychiatric intervention, obviously the primary goal and objective is to assess the patient, like you referenced, the affect and the other symptoms, to be able to best diagnose them in the most accurate way. But when it comes to therapeutic intervention, in addition to the therapist requiring to better understand the client to be able to provide optimal therapeutic care, the actual intervention requires trust. It requires a human connection. So the conversations of talk therapy, whether it's CBT, TBT, motivational interviewing, or the other host of therapeutic talk therapy, the actual care is the therapeutic connection, whereas with the psychiatric evaluation, ultimately the medicine will have the same potency, will have the same impact. So would you favor psychiatric intervention through telehealth over therapeutic? Would you say that both of them, are ultimately effective and pragmatic? Would you make a distinction perhaps between the initial evaluation or an initial session where trust is being developed and cultivated, and then maybe subsequently at some point down the road, several weeks or months later, once there's a very strong connection and meeting of minds, then telehealth can be just as effective? What would you say to some of these potential dilemmas?
Yeah, and they're great questions. And I think it comes down to, a therapeutic alliance. And a therapeutic alliance, which is what you referred to, is the most important in treatment, specifically in therapy. And in a psychiatric eval, there is that's obviously important as well, but it is more objective in the sense that there's certain, it's more algorithmic in a certain sense. I think with therapy, the initial intake would probably be very similar in certain ways to the psychiatric intake, but in terms of the follow-up, the medications are standardized, and in the sense that the pharmacokinetics obey the pharmacokinetics. And I think that one is looking and evaluating in subsequent visits how certain standardized, efficacy, but also side effects, which are measured in a somewhat more objective fashion. I think in therapy, for that is something that there's the treatment involves so many moving parts. It involves recent situational stressors. It involves stressors from past experiences that are being brought up or that are perhaps resurfaced recently. So, and I think because of the potential trauma or the potential recent stressors, it's really that therapeutic alliance is not only crucial for a client or a patient to be comfortable in giving out basically the data, which is the information about how they're feeling, but also connecting. And in terms of treatment, it's going to really help in terms of compliance. How are they going to do their therapy, whether it's cognitive behavioral therapy or dialectic behavioral therapy. So that comfort and that therapeutic alliance, I think, is something that what would lend itself more probably in person. I do think that if there is a initial therapeutic alliance with a therapist and a patient or client that was started and early, then I think that the variable of whether it was in person or not would be less significant. But I do think in terms of the question about psychiatry, about a therapist and how important that therapeutic alliance is, that's crucial. And in terms of the identification of symptoms, the continuity of therapy, and the feeling that there's a comfort level is crucial. And I think that the telemedicine would, in a certain sense, maybe take away a little bit of that comfort, just because I think as human beings, we like to kind of see each other and be able to just to feel comfortable, looking at one another in the same room versus a video or telemedicine. So I think, initially, that would be the therapy would actually be more helpful initially for identification, but I think as time went on, I do think that a Therapeutic Alliance would be helpful in person versus through the video.
Sure. That makes a lot of sense. You could always speculate, but I would love to know if in your experience, if this is actually a phenomena at all, where somebody who might otherwise be shameful about disclosing certain aspects of their feelings, of their thoughts, of their past, of their history, would feel a greater degree of comfort, quite frankly, to disclose that to a screen versus if somebody was in front of them, there would be too much shame and embarrassment for them to properly open up. Have you experienced that, or do you think that is a phenomena?
Oh, yeah, I think it is. I have an example on that. For a client that I was treating was suffering from conversion disorder, and it's a type of it presents as neurologic symptoms, but it's via psychological component to it. So this individual was having suddenly blackouts, and she would be in a store, she would be in a Walmart or Target, and suddenly couldn't see, and she would have to kneel down, and it would be extremely disabling because it would occur when she was also potentially driving. She would get a small aura, have to pull out onto the side of the road, and then actually have to call a police to help bring her home. And so this was an extremely disabling condition for her. She was literally couldn't get out of the house for 3 or 4 months. But she had said that before that, this was just very interesting that she was, because it was, I was seeing her via telemedicine, that she felt comfortable discussing that. And these were things that were challenging when she came into the psychiatrist or therapist in person. And it's unclear why, but that's, and this was, again, such a disabling condition. She had been checked out medically. There was no neurologic component to it, except that it was almost a hysteria, that type of anxiety that caused her to do this. And so that is an example where we were able to identify and then continue to carry out breathing techniques and doing some therapy on the video, on a telemed, where she was not able to, didn't feel comfortable doing that before. So that is an example of a situation where that occurred, and that it proved helpful, and this individual felt more comfortable not only disclosing those symptoms, but also being subsequently treated via therapy, but also medications as well for it.
Fascinating. And I'm sure that is definitely the case when it comes to, discussing and disclosing trauma and different, forms of abuse. It's probably easier to, for sure, for the first time, bring all that stuff up without feeling the heat and shame and potential humiliation of just disclosing that type of information. Last but not least, how do you see the future of telehealth? Do you see it continuing to be a prominent force, a growing force within healthcare, even once COVID will hopefully subside?
Yeah, I think it's a great question. That's something I think, in fact, a study recently, literally 2 days ago, came out looking at, I believe they sent out a survey to 2,000 providers. It was through Vanguard, and about 850 providers responded. And the positivity of telemedicine for the providers was quite high. And I think from the provider's perspective, I think it's something, even after COVID, will continue to remain used quite often. I think for the advantages we had alluded to before, the accessibility, the flexibility, scheduling, that it's quite. I think those are positive things that will continue for the clinician, and for the clients or patients. I feel they're thinking it's a very good platform as well, specifically for behavioral health. And I think, again, if one was to need behavioral health is not a procedure specialty, and because of that, specifically lends itself to being able to be used effectively for telemedicine. So I think it really will continue to be used quite frequently with and I believe in all settings. And again, not only outpatient, but I think more and more it's also being used as an inpatient setting in ER. I alluded to the ER setting and the outpatient, but I think in individuals in hospitals now, where inpatient units, more and more telemedicine is being used, where rounding is being done via telemedicine with a provider such as a psychiatrist versus that psychiatrist coming in person to round on the client. So there would be one mental health worker or a nurse setting it up in the room with a client, and the psychiatrist would be via telemedicine. So I see that also kind of taking off in a similar way that a number of years ago, radiology, analogous to what occurring in radiology, where there is a lot of radiology films being read by a group at Duke. So one large group was being able to do different, many different hospitals throughout the Mid-Atlantic and Northeast region.
Absolutely. And that makes a lot of sense. I want to thank you so much for joining us today and really providing so much practical and relevant insight into this very, very timely topic. And like everything, especially in regards to technology, it really has the potential to enhance and dramatically elevate the quality of our lives, the quality of the healthcare that we utilize. And we just have to obviously really make sure not to lose the humanity in the process, that human touch, which is so integral. But as a whole, as Dr. Shaywitz is suggesting, this will be will continue to be a very positive force in healthcare in general and behavioral healthcare in particular. Thank you again to all of you for joining us on another wonderful episode of the Discover You podcast. Take care and have a wonderful day.